I like it when a person points to their sacroiliac and says, "Oh, my pain always starts here." These are the patients who tell all their friends that we solved their chronic back pain that other providers couldn't. The body often sacrifices the sacroiliac joint to protect the lower back. The sacroiliac joint is incredibly mobile, which allows you to sit, walk, run, flex your thigh to your chest, and extend your leg backward. However, in the body, mobility comes at the cost of decreasing its structural support. Highly mobile joints are more likely to experience strains and sprains because more forces are placed on supporting tendons and ligaments. The tendons and ligaments absorb a tremendous amount of forces from various directions. Weakness in the core and hips leads to excessive strain on these tissues, often resulting in areas of poor healing or scar tissue adhesions. Treatment can often reduce acute pain through traditional therapies such as ice, heat, exercise, and stretching. The injured tissue will calm down, but that doesn't mean the tissue has healed. It doesn't hurt anymore, but the next strenuous activity flares up the poorly healed scar tissue. Soft tissue treatments are necessary to break down the scar tissue and facilitate proper healing. Scar tissue tends to accumulate in layers, like an onion. The outer layer becomes irritated, causing the current pain. When this layer calms down, the pain will subside. However, the body is not always good about tearing up the scar tissue layers and replacing them with the proper collagen fibers in ligament. For people with repeated sacroiliac injuries, standard office or home treatments will calm down the flare-up. However, these treatments will not cause the scar tissue to break down and properly heal. Shockwave Therapy and Graston Technique are two treatments we use in the office to force the scar tissue to remodel and heal. Graston Technique and Shockwave Therapy are excellent treatments for mechanically breaking down scar tissue bonds and triggering the body's healing processes. Breaking down scar tissue adhesions accelerates the conversion to proper collagen in tendons and ligaments. The treatment utilizes the body's natural healing and repair processes by causing micro damage to scar tissue. The Graston Technique utilizes tools to glide along the skin and apply shear forces to break the bonds of scar tissue. Shockwave therapy creates a high-speed compression on the tissue that effectively stomps on the tissue. The sudden impact stretches the less flexible scar tissue and breaks it, triggering the proper repair of tissue. Both of these soft tissue treatments create mechanical damage to scar tissue and enhance tissue repair of the sacroiliac joint and ligaments. These are the treatments that were missing from a patient's previous therapy. The other providers didn't address the poor healing along the sacroiliac, which became a chronic source of pain. For more information on chronic sacroiliac sprains and lower back pain, visit our website or read my book on low back pain and treatment options.